After you introduce yourself, check the patient's identity and explain what you're going to do. Get a good history, including past medical and surgical history, medicines, including over-the-counter herbs and supplements, allergies, family history, the patient's occupation, household makeup, and major stressors. Review of systems other than the head, neck, nose, and mouth. For instance, does the patient have any pain anywhere in their body, any trouble breathing, any fatigue, fevers, or sleep disturbances, change in appetite or weight, constipation or diarrhea, any skin changes? For the history of present illness, make sure to ask comprehensively about symptoms and questions specific to the head, neck, nose, and mouth. For instance, inquire about headaches, dizziness, head trauma, sinus pressure, and scalp pruritus. Have they had any nasal congestion, rhinitis, epistaxis, coughing or sneezing? Have they noticed any lumps, pain, or stiffness in the neck? Have they had mouth pain, dryness, lesions, bleeding gums, or trouble swallowing? Have they had dental problems, and when was their last dental exam? Have they recently been sick, been in contact with sick people, or traveled? Have they had any significant weight loss or weight gain? What is their smoking and tobacco use history? Wash your hands, ensure privacy, and make sure that the patient is at an appropriate height to protect your back. On general survey, note the patient's affect, behavior, mobility, body structure, and overall appearance. Vital signs are very often needed. Especially indicated in this exam may be temperature. To examine the head, palpate for shape and tenderness. Inspect for lesions, discoloration, hair distribution, cleanliness, dandruff, lumps, and lice. Concentrate then on the face. Does affect match conversation? Do both sides of the face move symmetrically? Are there any lesions or problems with skin integrity? Palpate the sinuses. Any tenderness? Now let's examine the nose. Inspect the external nose for lesions and symmetry. Does the patient have a deviated septum? This is a very common but remarkable finding. Note whether it's mild, moderate, or severe. This patient has a very mild deviation to the right. With the widest speculum available, inspect the inside of each nostril. Advance very slowly and brace your hand against the patient's face in order to protect the tender nasal septum. Do you see any lesions, bleeding, polyps, turbinates, or foreign bodies? Any exudate? If so, note its color and viscosity. Ask the patient to block one nostril at a time and inhale to assess patency. To start the mouth exam, inspect the lips. Are they chapped? Is there angular cheilitis? Ask the patient to show their teeth and gums. With a pen light and tongue blade, inspect the dentition, especially where the teeth and gums articulate. Is there swelling, redness, plaque? Are the gums recessed from the enamel of the teeth? Inspect the palate, buccal mucosa, pharynx, and inside aspect of the lips. Are there any lesions, edema, redness, or exudate? Are the surfaces shiny or dull looking? Inspect the dorsum and sides of the tongue, as well as the ventral surface for lesions. If there's an exudate on the tongue, try to gently scrape it off with the tongue blade. Find the tonsils if present and grade them. Is there exudate on the tonsils? Is there an odor to the mouth of alcohol, bad breath, or other unusual odor? Palpate the lymph nodes for enlargement, tenderness, and/or fixation. Cervical lymph nodes include the pre- and post-auricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial cervical, and supraclavicular nodes. The thyroid exam necessitates palpation of the thyroid, which can sometimes be accomplished more easily by displacing the thyroid to each side a little. Is the thyroid symmetrical, enlarged, nodular? Inspect and palpate the trachea. Is it displaced laterally, or is it exactly medial? The nurse may palpate and/or auscultate the carotids as part of the neck exam, or it may be included instead in the cardiovascular exam. When auscultating any arteries, be sure to use the bell to best hear bruits if they are present. Examination of the neck includes range of motion, flexion, extension, hyperextension, lateral bending, and twisting. Inspect and palpate the symmetry of the neck muscles. Is there any tenderness or spasm? Finish by documenting your findings carefully. Notes should be written concisely, precisely, clearly, and thoroughly.